Contrary to most contemporary folklore, definitely yes. In the DSM-5, the catalog of psychiatric disorders used by mental health and substance abuse professionals, there is a cannabis abuse disorder. There are 10 symptoms of cannabis use disorder. DSM-5. 1. Use of cannabis for at least a 1-year period, with the presence of at least 2 of the following symptoms, accompanied by significant impairment of functioning and distress. 2. Difficulty containing use of cannabis. The drug is used in larger amounts, and over a longer period than intended. 3. Repeated failed efforts to discontinue or reduce the amount of cannabis that is used. An inordinate amount of time is occupied acquiring, using, or recovering from the effects of cannabis. 4. Cravings or desires to use cannabis. This can include intrusive thoughts and images, and dreams about cannabis, or olfactory perceptions of the smell of cannabis, due to preoccupation with cannabis. 5. Continued use of cannabis despite adverse consequences from its use, such as criminal charges, ultimatums of abandonment from spouse, partner, friends, and poor productivity. 6. Other important activities in life, such as work, school, hygiene, and responsibility to family and friends, are superseded by the desire to use cannabis. 7. Cannabis is used in contexts that are potentially dangerous, such as operating a motor vehicle. 8. Use of cannabis continues despite awareness of physical or psychological problems attributed to use, e.g., inertia, amotivation, chronic cough. 9. Tolerance to cannabis, as defined by progressively larger amounts of cannabis, are needed to obtain the psychoactive effect experienced when use first commenced, or noticeably reduced effective use of the same amount of cannabis. 10. Withdrawal, defined as the typical withdrawal syndrome associated with cannabis, or cannabis or a similar substance, is used to prevent withdrawal symptoms. According to NIDA, the National Institute on Drug Abuse, a recent study reports that roughly 4 million Americans meet these clinical criteria in their cannabis usage.